If you re a man over 50 and things aren't working like they used to in the morning or in the bedroom, you've probably blamed it on low T or just getting older. That's what everyone says. But I'm going to tell you something that almost no doctor ever talks about. The real hidden cause of that fading strength and performance is not your testosterone. It's the silent stiffening of the tiny, microscopic blood vessels that are supposed to feed the area down there. Now, here's the good news. This is a problem you can actually do something about. You can start reversing it in as little as 7 to 10 days with a simple 3-part method that I give my private patients. My name is Dr. Selena Moore. I'm a board-certified urologist, and for the next few minutes, I'm going to show you exactly why this happens to so many men after 50, and the proven 3-step method that brings back reliable firmness, often faster than most men even think is possible. Make sure you stay until the end, because the second step in this method shocks almost everyone. Let me ask you something. How many times have you heard, "Oh, it's just normal after 50," or "Your testosterone is dropping," or the classic, "Just take the little blue pill"? But I want to share the truth that I see every single day in my clinic. I have plenty of male patients over 50, even over 60 and 70, who have perfectly normal testosterone levels, yet they still struggle. They still have that weak or unreliable morning response and performance issues. It's the delivery system. Think about that. It asks the microscopic blood vessels and capillaries that are supposed to relax and fill up with blood on demand. When they get stiff, when they get narrow from years of wear and tear, no amount of testosterone and no number of little blue pills can fully fix the underlying problem. This is why some men tell me the pill just doesn't work like it used to. It's not you, it's your microcirculation. It's quietly aging faster than the rest of your body, and no one is telling you what to do about it. So what's happening on a biological level? After age 50, 2 key things happen inside those tiny arteries that matter the most for male performance. First, you can lose up to 40% of your nitric oxide production. Nitric oxide is the critical signaling molecule that tells your blood vessels to relax and widen. When you don't have enough, they stay constricted. This happens from years of oxidative stress, maybe not getting enough good sleep, and chronic low-grade inflammation. The result is that the vessels simply can't open fully when you need them to. Here's an analogy I use with my patients. Think of it like a garden hose that's been left out in the sun for 20 years. The water pressure from the spigot, which is make your blood flow, is perfectly fine, but the hose itself is old, kinked, and rigid. It can't expand, so you only get a trickle of water out the end. Studies in the prestigious Journal of Urology have shown that poor microcirculation is the #1 predictor of performance issues in men over 50. It's an even bigger factor than testosterone levels. One specific supplement combination, one unique movement, and one simple activation trick you can do right before bed. If you do them daily, Most of my patients start noticing the first signs of stronger, more reliable response within just 7 to 14 days. So let's break it down. Every morning with your breakfast, you're going to take 3 things. First, if L-citrulline, 3,000 milligrams. And please note, this is not N-arginine. Many people confuse the two. L-citrulline is far superior because it bypasses the liver and converts to arginine in your kidneys, lasting about 8 times longer in your body. It's a much more efficient way to boost nitric oxide. This potent antioxidant protects the nitric oxide you reproducing and helps heal the delicate lining of your blood vessels. Third is vitamin K2, specifically the NK7 form. You need about 180 to 200 micrograms. This is crucial. Vitamin K2 acts like a traffic cop for calcium in your body, directing it out of your arteries where it causes stiffness and into your bones where it belongs. This exact trio was studied in a 2022 German trial on men aged 50 to 70. The results were astounding. It increased endothelial function, which is a measure of blood vessel flexibility, by 42%. Clinically, patients report a noticeably fuller and firmer morning response starting around day 8 to 10. The cost for all 3 is about 80 cents a day when you buy the quality brands I trust. And I'll put links for those down in the description. Now for step 2, this is the movement that 95% of men have never done correctly, and it only takes 3 minutes a day. This is not regular Kegels. In fact, doing regular Kegels the wrong way can sometimes make things worse. This is a sequence called the reverse Kegel plus hold, and it's designed to retrain your interior pelvic floor and boost nitric oxide production locally, right where you need it. Here's exactly how to do it. Stand up tall with your feet about shoulder width apart. Take a deep inhale through your nose, and as you do, gently push out your pelvic floor, almost as if you were starting to urinate. This is the reverse Kegel. You should feel a gentle downward pressure. Gently lift and squeeze the entire pelvic floor, like you're trying to stop the flow of urine. This is the normal Kegel. Hold that gentle squeeze for 10 seconds. Then relax completely for 5 seconds. That's 1 repetition. You're going to repeat that 10 times, which should take about 3 minutes. I've found that men who add this simple exercise to the supplement stack see results 2 to 3 times faster. Urology departments in Europe are now teaching this exact sequence because it's so effective at improving local blood flow and control. Finally, step 3. Right before you turn out the lights, I want you to do this. Lie on your back comfortably in bed. Place 1 hand on your chest and 1 hand on your belly. You're going to practice diaphragmatic breathing. Breathe in slowly through your nose for a count of 4. Feel your belly rise, not your chest. And here's the key. While you are exhaling for that entire 8-second count, I want you to very, very gently tense your pelvic floor. It's not a hard squeeze, just a light activation. Do 10 of these slow, conscious breaths, this simple practice does two amazing things. It activates your parasympathetic nervous system, which is your rest and digest system, taking you out of a state of stress. And it floods the pelvic region with healing, oxygenated blood flow while you sleep. This is the missing piece that most other protocols completely ignore. Now, while you're doing this, there are a few common mistakes I want you to avoid because they will slow down your progress. As I mentioned, your body breaks it down too quickly after age 50. Stick with L-Sictulins. Squeezing too hard and too fast can actually increase tension and make stiffness worse. Third, don't sit for more than 45 minutes at a time without getting up and moving around. Prolonged sitting compresses the blood vessels and nerves in your pelvis, reducing blood flow. And fourth, try not to eat heavy meals after 7 p.m. This forces your body to focus on digestion overnight instead of on cellular repair and restoration. So, what can you expect? Based on my patients' feedback, here's a general timeline. During days 3 to 7, you'll likely notice better morning fullness and find that arousal is a bit easier. Between days 10 and 14, a noticeably stronger and longer-lasting response is coming. By week 3 or 4, most men report their performance feels more like it did in their early 40s. And for mild to moderate cases, we often see full restoration within 2 to 3 months. A quick but important disclaimer: if you are currently on blood pressure medication, especially nitrates, you must check with your doctor before starting a high dose of L-citrulline, as it can lower blood pressure. And remember, this is for educational purposes. This is not medical advice. This is what has worked for thousands of my patients. But you should always consult your own physician before starting any new health regimen. So, if you are ready to stop accepting weak performance as just a normal part of aging, if you're ready to take back control, you can start this protocol tonight. Thousands of men, just like you, have reclaimed their confidence and vitality with this exact method. If you're committed to trying this, drop "I'm starting today" in the comments below. Let's create a community of support. Hit that like button if you believe that being over 50, 60, or 70 can still mean being strong, confident, and capable in every area of your life. And finally, be sure to subscribe and turn on your notifications. I post real, science-backed solutions that actually work. You absolutely still have time to turn things around. Let's get your strength back, the natural way. Thanks for watching.